Good evening, everyone. Welcome to our webinar on cataract surgery and special lenses. My name is Louise, and I'm your host this evening. Our expert presenter is Ms. Hanbin Lee, Consultant Ophthalmologist. This presentation will be followed by a question and answer session. If you'd like to ask a question during or after the presentation, please do so using the Q&A icon, which is at the bottom of your screen. This can be done with or without providing your name. Please note the session is being recorded if you do provide your name. If you'd like to book your consultation, we'll provide contact details at the end of this session. I'll now hand over to Ms. Hanbin Lee, and you'll hear from me again shortly. Thank you.
Thank you, Louise. Good evening, everyone. Thank you for joining us this evening. My name is Hanbin Lee, and I'm a consultant ophthalmologist at Benenden. So this evening, we're going to cover what are cataracts, what does the surgery involve, and what to expect, and we'll discuss your process through the eye unit, and at the end we'll answer your questions. So I'm a consultant specializing in cataract surgery and corneal conditions. I'm a consultant at Benenden specializing in special lenses, and I'm also a full-time consultant at Frimley Health NHS Foundation Trust. So these two images demonstrate the anatomy of the eye. And in relating to cataract surgery, the key areas include the cornea, as you can see here. Hopefully you can see my cursor, the lens, which then becomes your cataract. And then behind the cataract is something called the vitreous humor, which we often refer to as vitreous jelly. And then the retina, which is the nerve layer of your eye. The eye itself acts like a camera. So the cornea, the lens, light goes through these structures and then reaches the back of your eye, the retina. Then it goes to the optic nerve, and the information is then processed in the brain. So when your lens loses transparency, so when it becomes a cataract, that's when the visual disturbances start. And that can be seen in a number of ways. For example, you may have been able to see an eagle 50 meters away, but that may now seem very blurry. And we'll discuss what types of cataracts that can affect you. So this is an image that we've taken on a slit lamp, which is a microscope. And this is how your eye is usually examined when you go and see your optometrist or your eye consultant. And nuclear sclerosis is one of the most common type of cataracts. And it's often, it's the most common and related to aging and getting wiser in life. And you can see that there's this yellowish haze. Cortical cataracts are also quite common. You can see these white spokes, and they can also cause visual disturbance. I don't know whether you can appreciate the haze that you can see in this thin slit beam here. And this can also cause fairly significant visual disturbance. And this is called a posterior subcapsular cataract. So this type of cataract really affects the back part of your natural lens. Posterior polar cataract, you can see most of the lens is clear, but this tiny little circle, but this can really affect your vision quite significantly. And this again affects the back part of your natural lens. So what are the causes of cataract? As I've mentioned, the most common cause is age-related. So as time goes in your life, your natural clear crystalline lens gets hazy. People who smoke tend to get cataracts earlier, or if you have systemic conditions like diabetes. Some people are born with cataracts. If you've had any injuries in your eye, that can then accelerate the formation of a cataract as well. If you take any medications like steroid drops or tablets, that can also accelerate the formation of a cataract too. So a cataract can really affect you in a number of ways. You may find that the garden, the flowers that you are seeing, or the painting that you are doing just seems a little faded, and the colors are not as brilliant as they were before. Or you may simply notice that your vision is blurry. You may drive a lot at night, and the oncoming headlights are very bright. You see halos and glare. Or your optometrist may tell you that your glasses frequently need changing, and developing a cataract can certainly contribute to this. Some patients with a cataract may notice that they see double vision when they cover one eye. And all of these can present at different times. And really, cataract is the way we treat cataract has really changed. We no longer wait for the vision to drop to a certain level. So it's all about how it's affecting your life and how it affects you as a person. So there are many reasons why someone may choose to have cataract surgery. The most common reason is that it's affecting your work, your daily activities, your ability to drive to work, or your hobbies such as playing tennis or golf, painting or reading. And there are also clinical reasons too. When a cataract develops and it gets very thick, in some patients, they are more at risk of developing an acute angle closure glaucoma attack where the pressure in the eye suddenly goes up. And this might be the reason why they might need a cataract operation. Or they may be having a retinal operation and it may be combined with the procedure. And in patients who have diabetes, a cataract may obscure views to the back of the eye, making the retinal screening appointments difficult. So many of you may already know Claude Monet. His vision was famously affected by cataracts. And you can see in this painting that before he was diagnosed with cataracts, the brilliant colors of his Japanese footbridge. And after he started developing cataracts, he described his garden to be more yellow and murky. And you can really see the contrast of how cataract affected his sight. So what to expect with cataract surgery? So first, a specialist nurse, eye unit nurse, and a technician will take a detailed medical and social history. They'll measure your blood pressure, your blood sugar levels, and also check your visual acuity. So this is like the vision check you may have already had at your optometrist. They'll check your eye pressure, and they will also do some special investigations that relate to your cataract surgery. One being biometry, which is measurement of your eye. So for example, the length of the eye, the different curvatures of the eye and the compartments, as well as a scan of the back of your eye, your retina. And we will scan the central part of your retina called the macula. Now, for patients who may be opting to have a special lens or have astigmatism, we will also carry out a scan called a pentacam, which maps out the curvature of the window of your eye, your cornea. After this, you'll be seen by a consultant, and he or she will carry out an eye examination on the microscope. This is where you place your chin on the slit lamp. Following this, they will discuss and confirm your eye and health history. They'll review your test results, and then they'll go into the discussion of what you would like to achieve with your surgery, the type of anesthetic that we offer, and discuss the benefits and the risks of surgery. In this consultation, you'll also have a chat about what refractive outcome you may want. So for example, after cataract surgery, your natural lens is being removed and an implant is inserted. So the prescription of your eye will change. And this discussion will be had during your consultation. Typically, a patient may choose to correct their vision for distance. And this is a kind of information that will be discussed at depth. And then we'll also go through the consent process with you, and you'll be given a copy of your consent form. So I mentioned that your prescription will change after surgery. There are a number of lens options, and you may have already heard of monofocal lenses. These are most commonly used lenses, and they are able to offer one focusing distance to give you good clarity of vision. So they can be either set to focus your vision for distance, intermediate, so middle, such as your computer, or your mobile phone, or for near for reading. Now, most patients do opt to correct their vision for distance and wear glasses for reading and computer work if they do opt for this type of lens. However, if you're used to being short-sighted, so if you're myopic and you want to retain your reading vision, that can also be an option that you can decide to go for. Or if you are used to something called monovision, where you use one eye for distance and one eye for reading, and you've been doing this for some time with contact lenses, then that can also be an excellent option with the single focus lenses. Now, if you have astigmatism, which I'll come to on the next slide, then with a monofocal lens, all the astigmatism is unlikely to be corrected with this surgery, so you will require glasses for distance and near. So what is astigmatism? So the cornea, the window of your eye, is usually dome-shaped or round-shaped like a ball. But when you have astigmatism, the curvature of your cornea is not the same in the two angles. So it's shaped more like an egg or a rugby ball. And astigmatism contributes to your glasses prescription and the prescription of your eye. And if it's significant, it can make your vision blurry. And it is surprisingly common. When someone has cataract surgery, following their operation, the astigmatism can be corrected either with glasses or contact lenses or laser. However, there's also the option to correct astigmatism during surgery with a lens called a toric intraocular lens. And this image is showing an example of a toric intraocular lens. And you can see these two lines. And those lines are what we will use to orientate the lens inside your eye in a specific angle, and that will treat most of your astigmatism and therefore make you less dependent on glasses, depending on what distance you go for. So other options include extended depth of focus lenses. These lenses mainly aim to correct your vision for distance and for intermediate vision. So, for example, computer work, cooking, gardening, and also dashboard vision. Some patients will also be able to get a degree of reading vision, for example, in large print, but with these lenses for small print or reading in dim lighting or reading a menu in a romantic restaurant, you will require a light pair of reading glasses. And with these lenses, we can also correct astigmatism too. Then there's also the option of multifocal lenses. You can see the rings here, which gives you different zones to correct your vision for distance, intermediate and near. Now, these aim to reduce glasses dependence for all activities. However, some patients may still require a small pair of reading glasses, especially in dim lighting. And although they have the extra technology, there is a small risk of having glare and reduced contrast sensitivity, and they're not suitable for everyone. So some patients are very keen on having spectacle independence, and they accept the slight trade-off of having glare and reduced contrast sensitivity. So what actually happens on the day when you go for your surgery? So you'll be admitted as a day patient. We'll carry out the preoperative checks. Your pupils will be dilated, ready for surgery. We'll check your blood pressure, blood glucose. And if you feel very nervous, you can have a tablet to relax you. We advise you to wear dark and comfortable coloured clothing because we use iodine to clean around the eye. And it's advisable to have a light meal or a breakfast before you attend. And we advise you that you don't have any alcohol before attending surgery. So the surgery itself, it takes between 10 to 20 minutes. You'll be taken into the operating room, sit on our comfortable operating chair, and we will position you back on the chair so that the head is positioned parallel to the ceiling. You'll have a pillow underneath your leg to take the pressure off your back. We'll give you local anesthetic drops and iodine drops, and the eye will be cleaned, and a drape will cover your face to about this length. And if you feel very claustrophobic, we can always lift the drape and stick it to the microscope so that you have a little bit more space. Then a small speculum will gently open your eye, so you don't have to worry about blinking, and you'll be advised to look straight into the operating light with both eyes and blink as normal. And some surgeons will play some nice relaxing music, and you're advised to relax as much as you can in the circumstances. So I'll briefly take you through some of the surgical steps for your interest. So cataract surgery is now done through a very small incision, typically 2.2 millimeters. Then we open up the capsule of your cataract, and that's called capsulorhexis. Then we use ultrasound technology, which is called phacoemulsification, to break up the cataract and also to aspirate the cataract. Then after this, into the same space, this space, we insert the intraocular lens. Now, the lens is placed in the eye without any sutures, and following the lens insertion, we also instill antibiotics directly into the eye and seal the eye. And then you'll have a clear shield to protect the eye, which you'll be advised to wear. Cataract surgery recovery, the full healing process can take 4 to 6 weeks. Most patients can return to their usual activities after 1 or 2 weeks. And you will be given eye drops for 4 weeks following surgery to reduce the risk of infection, inflammation, and to control swelling. Now, the vision will feel blurry immediately after your operation because you'll have local anesthetic in the eye and you would have had a bright light on your eye during surgery. After the anesthetic wears off, then your vision will start to come back, and day after surgery is when you'll start to notice the brightness, and that will improve each day. Now, after surgery, we are available over the phone and also in clinic if you need us. And then we now come to the risks of surgery. So it's really important to remember that cataract surgery is very safe, it's very successful, and in improving, your vision and quality of life. But it's like with all surgeries, there are unfortunately risks. And some of the risks include problems that can happen during surgery, such as a small tear in the thin capsule that I showed you that holds your cataract, or part of the cataract can displace the back of the eye. And after surgery, there are other risks, such as retinal detachment, which is when the nerve layer splits away from the balloon casing of your eye, infection, inflammation, and issues with the lens implant. Now, what's important to know and remember is that most complications can be treated with either further drops, laser treatment, or surgery. However, there is a very serious risk of potential visual loss to the eye as a result of the complication in 1 in 1,000 patients. Now, this should be discussed in detail again in your consultation, wherever you go to have your eye operation. So we are a dedicated eye unit in Benenden. We have a team of 12 experienced consultants, and also a dedicated ophthalmic team, including nurses, technicians, healthcare assistants, as well as administrative team who are used to dealing with cataract patients, lenses, and equipment. And I think that then concludes the presentation. So these are my colleagues, some of you who you may also already have met. And we have a short patient testimonial, which I'll play for you now.
Hi, my name's Delia. I'm a Benenden member. I had my cataracts removed in February and March. I have severe astigmatism, which was corrected. Over the last year, I've really struggled with reading. I couldn't read very small print, and driving was a real problem, a real struggle, so much so that I had to give up driving at night. I was offered toric lenses to correct astigmatism, and I chose to have one lens for distance and one lens for reading, which has been mind-changing because I've now been able to totally dispense with contact lenses and glasses. The procedure was really short, about 15 minutes, and nearly painless. There was really good follow-up after the operation. I was given a phone call 24 hours afterwards. I had a booklet given to me. I also had a droplet charge to help me put the drops in. And there was also a 24-hour helpline provided as well. In the 3 to 4 months since I've had the procedure, it's been life-changing. I've been wearing glasses and later lenses since the age of 11. I can now drive at night, I can read, I can swim without worrying about water getting in my eyes. It's an absolute miracle. Colours, the world seems a brighter place, and the colours almost jump out at me. I would 100% recommend Benenden Hospital. My treatment has been exemplary from start to finish. It couldn't be bettered.
Okay.
Yes, now we'll take some questions. So thank you very much for that really interesting presentation. We have many questions through, so I will try to get through as many as we can. The first one is, are short flights allowed post-procedure?
We usually advise you not to travel immediately after surgery. So I would advise you not to travel for at least a week to 2 weeks, just in case if you develop a problem and you need us and if we need to see you. But usually cataract surgery, we don't put any expansible gas in the eye. So technically flights are fine, but I normally advise patients not to travel immediately afterwards.
Okay. This person says they have dry eye syndrome. Will this cause any more problems with this procedure?
Yes, that's a really good question. Dry eye syndrome can sometimes feel worse after cataract surgery. So I would advise that you increase your dry eye treatment, or that you see someone prior to having cataract surgery to optimize the surface of your eye, as this can affect the outcome of surgery.
Okay. How accurate can you be pre-op as to whether or not glasses will be needed afterwards?
Okay, yeah, that's a really good question too. It really depends on your previous ocular history, for example, whether you've had any laser eye surgery, as this can affect the accuracy and the level of your prescription. And it also depends on what kind of outcome you choose to have, whether you are short-sighted or long-sighted, and how, the degree of your prescription as well, and what kind of lens you opt to have. But your eye doctor should be able to give you a reasonable advice on how close they think they might be able to get for you. With surgery, it's difficult to guarantee 100% perfection, but we can try to get you as close to as what you would want to achieve.
Okay, thank you. Does having glaucoma controlled by drops complicate having toric lenses fitted as part of the cataract procedure?
So it depends on the degree of glaucoma, how advanced the glaucoma is, and whether you're currently on glaucoma drops following a previous glaucoma operation, such as a trabeculectomy. If it's just drops and you've never had glaucoma surgery before, then a toric lens can still technically be used, but I think it would depend on the severity of the glaucoma and the eye pressure. I do still use toric lenses in patients with mild glaucoma where it's well controlled, but I think it would depend on your full eye examination.
Okay. This person says they are allergic to shellfish. If you use iodine, can they still have surgery?
Yes, we can. We can still use iodine. If you have an iodine allergy, we do have an alternative that we can use.
This person says they have a relaxing device called a sensate, which is worn around the neck, and they listen to music or meditation whilst wearing it. Is this something that could be worn during the operation?
I think we would need to look at the device just to make sure that we would have enough space to carry out the operation. And also during surgery, we put an adhesive drape which will be stuck down to your eye area, and that will cover your face as well. But sometimes some fluid can drip through to your ear, and we wouldn't want to damage, your machine. So probably best to bring the machine to show us if you can during surgery, during your preoperative assessment, so that we can have a look.
That sounds sensible. This person says, is it better to have cataract surgery sooner than later or wait until it's really bad?
So nowadays, cataract surgery is all about your symptoms. So it depends whether it's affecting your life, essentially. Previously, many years ago, there was a certain visual standard that you had to be worse than in order to have cataract surgery. But now, if it's affecting your life, for example, such as driving, reading, working, then you can have cataract surgery. Of course, it is an elective procedure, so it's whether you want to go ahead with the operation. So there's no kind of hard and fast rule. Probably if the cataract's already quite advanced, then I would generally advise people to have it sooner than later, because when cataracts become very thick or dense, as we say, the operation can potentially come with a slightly higher risk of having problems.
Thank you. Noting that the arms of the cataracts would line the wall of the eye to support the cataract within the pocket, are all eyes the same size, or do sizes of the cataract implants vary?
Yeah, that's a really good question, and it's a question that we get often in clinic. One of the key investigations that we do when you go to a cataract clinic is the measurement called biometry. And this is where we measure the length of your eye, the depth of the front chamber of your eye, the curvature of the window of your eye. And we use these measurements and calculate your lens. So for example, someone who's very long-sighted will have a different size lens to someone who's very short-sighted. So it depends on your eye prescription. even, you have two eyes and one eye might have, for example, a +20 lens, but the other eye may end up having a +18 lens. So there is a difference depending on the eye measurements.
Thank you. This person's had their eyes lasered, and they ask, how will this affect them having a cataract operation now?
Okay, so if you've had laser refractive surgery where you had laser to the cornea, it does change the shape of your cornea and the relationship of the front and back of the cornea. So it can make the lens calculations less accurate compared to someone who hasn't had any laser eye surgery. However, there are now very good lens calculation formulas available. And if you were to go for cataract surgery, we would use that and compare a few different formulas to pick the best lens for you. There is a slightly higher chance that you may not exactly reach the target that you had hoped for, but unfortunately, that is a risk with having had it. But I would say nowadays, there's lots of good formulas out there.
Thank you. Sharon says they have a prescription that includes a prism. Will this necessitate them wearing spectacles all the time after their surgery?
Yeah, again, very good question. It depends on the degree of the prism and how big it is. Sometimes after cataract surgery, patients find that their prism prescription reduces, but it would really depend on why you're wearing the prism. So it would be a case-by-case situation. It may be that if you're wearing quite a big prism, you may still need some of that in a pair of glasses after surgery.
Okay. What kind of tablets do you use to relax?
It depends on which unit you go to. There's a number of tablets that you can have. In the unit here at Benenden, we use diazepam.
Thank you. Christine says she lives on her own. Will she need support after surgery?
Okay, so it is helpful to have someone nearby or someone who can come and stay with you for the first night of surgery. However, lots of patients who live on their own can still manage. What I would suggest is, in that case, just try and get everything in order at home, have your evening meal ready, make sure the house is in order before you come for surgery so that you don't have to do too much that first night and the next day. With your eye drops, we can show you how to use them, or if you're at another hospital, they should be able to demonstrate how to use those drops following surgery.
Thank you. Irene says she has age-related degeneration. How will this affect the operation?
So this doesn't, I'm assuming you're talking about macular degeneration. So this doesn't affect the technicalities of the operation itself, but it can affect the outcome of surgery. Because we're dealing with the lens, which is in the front compartment of the eye, we're not working on the retina. You may find that compared to someone who doesn't have any changes in the macula, the visual improvement may be not as much, so slightly guarded visual prognosis. However, that again depends on the degree of your macular changes.
Alison says that she's heard that you shouldn't bend after surgery. She has a small dog. Is this the case, that you shouldn't be bending?
Yeah, really good question. We generally advise patients not to bend over for at least 1 week following cataract surgery. And this is especially if someone has had a toric lens, which can rotate in the eye. And the other concern is if one eye is blurry and there are other objects around the ground as you're bending over that may poke you in the eye, that will be of concern. So yes, in general, I would say for 1 week, avoid bending over.
How soon can a second eye be treated?
So second eye surgery usually is done between 4 to 6 weeks after the first eye. In some patients, it may be sooner, but there's no hard and fast rule to it. Yeah.
And I guess related to that, can you have both eyes done at the same time?
Yes, bilateral cataract surgery has become more popular, particularly ever since COVID. And it has been the case in lots of different countries like Sweden, Canada, and it can be carried out. At the moment, at Benenden, bilateral surgery is usually for patients who are having special lenses, because it helps with quickly adapting to the special lenses. So it depends on where you have your surgery as well, but it is possible. And although the risks of having bilateral surgery are very small, it is something that you should also consider in your decision making, the potential risk of developing problems in both eyes.
This person's read that not everyone can adapt to EDOF lenses. What does this mean, and what happens if this is the case? Can they be changed?
Yeah, great question. So, yes, now the compromise of having extra technology in the lens is that it can increase the chance of people feeling that their contrast sensitivity isn't as good, or they may experience halos and glare. Now, most people do adapt to the lens with time. So it's called neuroadaptation. And the time period can really vary between person to person, typically 3 to 6 months. There are some patients who don't adapt to this and want to have the lens removed. And this can be done, although the surgery for exchanging the lens itself for a different lens is not without risk.
This person doesn't have cataracts, but asks if they can still have eye surgery to correct astigmatism and long distance vision.
Okay. So it would depend on the degree of your astigmatism and your eye prescription. And I would suggest that you go and see an optometrist to have this chat first, because it also really depends on your occupation, your age, the general health of your eye. It's not a hard and fast rule, but if you don't have a cataract at all, then that becomes a lens exchange, which then takes you into a different area. And there are lots of different ways to treat astigmatism, and not just cataract surgery. So I would suggest you go and see your optometrist first to have a chat about this, because it would also depend on all the other factors about you as a person, not just having the operation.
This person has a syndrome that I'm going to try and pronounce, but it might be a silent S. Sjogren's syndrome?
Syndrome,
Yeah.
yeah.
And would this affect matters?
So Sjogren's syndrome can give you very dry eyes and a dry mouth. And yeah, that's a really good question. Patients who have Sjogren's can experience drier eyes essentially after surgery. So it would be really important to again optimize the dry eye disease and the surface of the eye before having surgery. And I would recommend after having cataract surgery to increase the frequency of your usual eye lubrication.
Thank you. Audrey says she has had eye surgery a year ago to remove sun damage. Will this affect getting surgery? She also suffers with dry eyes, blepharitis. However, this is practically cleared up now.
It would depend on where exactly the sun damage was removed. If it was in the eyelids, then yes, it shouldn't be a problem. You can still have cataract surgery. If this was on the surface of your eye, for example, the conjunctiva, so above the white casing of your eye, then that may change things slightly. But I would advise see your ophthalmologist or come and see us, and it would be really case by case, I would say. And I'm glad to hear the blepharitis has cleared up, because that's also really important to do prior to your cataract operation.
Okay. Can you replace cataract lenses with the latest available new lenses?
So I think I'm understanding the question as can you
I think
replace?
it says someone's already had cataract lenses, but then newer lenses come out and
I
they be
see.
replaced. That's how I read it.
Oh, yes, sorry, yeah. It would depend on how long the lens had been in the eye, because the longer the lens has been in the eye, the more complicated the exchange process would be. And in general, I would advise you, if you are satisfied with the vision and you're managing well with your glasses, if it's been a very long time since you've had surgery, probably best to manage it conservatively, because exchanging the lens is not risk-free. And there may be other options that you could explore apart from simply exchanging the lens. So yes, I would advise a consultation to consider that, yeah.
How long do new cataracts last?
So
The
shelf
lenses.
life of an intraocular lens is forever. And some patients develop something called posterior capsular opacification, typically a year to 2 years following surgery, where someone may say, oh, your cataract has grown back. But in fact, it's actually the cells on the capsule that's holding your lens that's causing the vision to be foggy. And this can be easily lasered with a procedure called YAG laser capsulotomy that can clear your vision. So essentially, the lens is permanent.
Can you use an eye bath to administer drops?
I would advise you to use a eyedropper aid to use the drops. If it's an eye bath that isn't with any other fluid, then that should be fine. But it would be best for you to show us what exactly you mean, so that we're giving you the best advice on that.
Yeah. Can you have a general anaesthetic if you're very nervous?
Yes, if you are generally fit and well, and if you are very nervous, you can have a general anaesthetic for your cataract surgery at your local hospital. We don't offer general anaesthetic for cataract surgery at Benenden. What I say to patients is that if you're not sure, there is also the option of having the surgery with oral sedation. And also you can have an extra anesthetic injection around the eye, which then helps you feel less of the operation itself. So that is an alternative if you go to if you are at, for example, if you want to have a general anesthetic, but you want to find out about different options, alternatives to that.
Okay, thank you. We do still have quite a few questions. I think we might just do a couple more, and then we'll if you've provided your name, we'll email you the answers at a later date. So I'll just answer some of the anonymous ones here. So a question is sneezing an issue after the operation?
No. I mean, the eye is sealed at the end of the procedure, unless during the sneeze, there's inadvertent damage to the eye. Like, for example, if you poke your eye, or if you accidentally hit your eye with something, then yes, there is a risk, but no, just sneezing, no.
Okay. And the last question we'll cover off is, how often do toric lenses move and need to be adjusted at another visit?
Yeah, excellent question. They don't move very often, because They offer good stability, but it's really important in the first hour, particularly after toric lens surgery, that you kind of rest and sit quietly. You don't rub your eyes, you don't bend over. And also in the first week, about 4 to 5% of toric lenses may need a rotation. However, the rotation surgery, the second surgery to rotate it, is a little bit like having a cataract operation, but shorter. So it's not a major issue if it requires rotation.
Okay, so thank you very much. I'm sorry if we didn't answer all of your questions, but if you've provided your name, we'll be able to answer yours via email. Can we just move on to the next slide, please?
Oh, sorry.
So as a thank you for joining this session, we're offering 50% off the value of your consultation, a call back from a dedicated private patient advisor, an email tomorrow with a recording of this session and further information, and updates on news and future events. We would be grateful if you could complete the survey at the end of this session to help us shape future events. And if you would like to discuss or book your consultation, our private patients team can take your call until 8 p.m. this evening, or between 8 a.m. and 6 p.m. Monday to Friday, using the number on your screen. You can also book your consultation on our website with the discount code Cataract50 in capitals. A link to book will appear once you've submitted your survey response. Our next webinar is on varicose vein treatment next Monday, which you can sign up to via our website if that's of interest. So on behalf of our presenter and our expert team at Benenden Hospital, I'd like to say thank you for joining us today, and we hope to hear from you very soon. Thank you and goodbye.
Very much.
Thank you.